We tend to focus on the big event, the accident, the illness, the operation. But it's what happens after the crisis passes that may matter the most: rehabilitation. HealthBeat's Kathy Jadruzak took a look at one of Brooklyn's major rehab facilities and met a man there with a real comeback story.
You want to come a little closer? No, that's good. Okay. Press it all the way out. All the way.
Victor Hall, a diabetes patient, battled an infection in his left foot and had to use crutches to get around. In June, when the infection spread to another side of his foot, his leg had to be amputated. But within months of the surgery, the staff at Kingsbrook Rehabilitation Institute got him up and walking.
I'll come 3 times a week. And I mean, it'd be days like I don't feel like going, but I just say to myself, I have to go. Because I mean, if I don't go, how am I gonna get better? I mean, people are here to help you. You're not here to help them.
The staff at the Rehabilitation Institute treats patients who have been physically or cognitively challenged due to a number of conditions, such as stroke, spinal cord injury, cardiac surgery, Parkinson's disease, or as in Victor's case, amputation.
He was on our service back in July of this year, stayed, I believe, under 2 weeks on our inpatient service, and at that time we really focused in on a pre-prosthetic training program where we got him functionally independent out of bed, transferring from a bed to a chair, and up and walking with crutches and a walker to make him functional, and in that time getting him to be comfortable with the fact that he had a residual limb.
Support yourself here, coming down with a prosthetic leg, okay?
After the scar healed, Victor received a temporary prosthesis. Now he's working on building his endurance and balance and waiting for his stump to mature. Soon he'll receive a permanent prosthesis.
He is right now in a long-term phase of rehabilitation. Okay, so some of the goals for him would be walking maybe without his cane, climbing stairs, step over step.
Hall was diagnosed with diabetes 27 years ago, and due to the long-term effects of the disease, he's been a frequent patient at Kingsbrook.
They have a good staff here. It's helped me a lot. I mean, it's true. I mean, like you said, some people say you can do it on your own, but no, because you have trained people here. It might push you, but it's pushing you for your benefit.
They may attain the same goals on their own, obviously, but it will take them a lot longer time. Plus, they may develop contractures or postoperative complications, such as infections, sores. Okay, so with a monitor program like this, we minimize the chance of that.
Kingsbrook Rehabilitation Institute was established in 1976, and over the years it has gained reputation for excellence. It is also home to the only Brooklyn-based traumatic brain injury program.
Rehab is a specialty where we really focus in on a multidisciplinary approach for patients. We are, as physiatrists, which are the doctors of rehabilitation medicine, we integrate our services with multidisciplines. And our ultimate goal is to make the patient as functionally independent as possible. And in many times we are able to achieve that goal.
Rehabilitation takes time and patience, but it also requires motivation and family support. Hall feels lucky to have both. His 19-year-old son accompanies him frequently.
Your turn.
You do my rehab for me for the day.
Yeah?
At first, I was depressed a lot. You know, just didn't, because I'm the type of person I don't like nobody to take care of me. When I was in this hospital, I met a man that had no legs. I learned then that there's always somebody that has a worse problem than you. So you can't just sit around, sulk, and cry about it. You just have to do what you got to do and move on and maintain your life.
With every week, Hall feels better. He's even able to drive his car again. Dr. Ross and physical therapists have a bright prognosis for him.
I expect him to be bowling. That's his goal, and I think we can achieve that goal.
You're supposed to learn something when you go to school.
In his case, the amputation gave him a new outlook on life because we got him functional. I don't see a disability because he's functioning and he's independent, and he's probably at a higher level now than he was when he had his leg.
Reporting for HealthBeat Brooklyn, this is Kathy Jadruzak.